Good afternoon and welcome to COVID-19 update stories and lessons from the front lines of IT, a health system CIO Media Inc. production sponsored by Hyland Healthcare. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of Health System CIO, and I will be your moderator today. We hope for your participation today. We've got the questions and comments box you can use, and we're going to do a little poll later in the program. Little tips on how to get what I think is the best view of the event today. First thing you want to do at the top of your screen, click on that little drop down and pick the side-by-side mode. Then you can slide the divider over to get everything the size you want it. And you want to see it's a speaker view in the top right-hand corner. That's a nice view to enjoy the event today. So you see how we're going to spend our time. We're going to go about 35-40 minutes with our main panel discussion featuring Lisa Stump, SVP and CIO at Yale New Haven Health System, Chuck Christian, VP of Technology and CTO with Franciscan Health, and Colleen Sirhal, Chief Clinical Officer with Hyland, and then we will do our audience Q&A. So let's jump right in and get started. Lisa, let's start with you. Can you give us an overview of your organization and your role?
Happy to, Anthony. Thank you, and welcome everyone this afternoon. As Anthony indicated, I'm the Chief Information Officer for the Yale New Haven Health System and Yale School of Medicine, located in New Haven, Connecticut. Our health system is comprised of 5 hospitals across 7 campuses, located primarily in Connecticut, but also in Rhode Island. We have over 300 ambulatory locations in the states of New York, Connecticut, and Rhode Island, serving about 2.6 million ambulatory visits and about 125,000 inpatient discharges each year. So really happy to be here with everyone today.
Very good, Chuck.
Hey, good afternoon, everybody. Chuck Christian, I'm the Vice President of Technology and CTO for Franciscan Health. It's a, depending upon how you count them, 12 or 14 hospital system serving the western part of, with a central and western part of Indiana, all the way to Chicago. We have about 400 other locations for physician practices, imaging, reference labs, draw stations, all the way up into southern Michigan. We've got about 500 folks in our IT shop, and if anything's broken, it's my fault. So I have responsibility for all the technology in the organization, including the phone system, networking, and anything else that Charles wants to give me to do. So
very good. Chuck, how long have you been there now?
About 15 months.
Okay.
I hit the sweet spot. You know, I got to do some really cool stuff last year. Then I got right in the middle of COVID this year. So it's been, I've been training all my life for stuff like this. So
that's a really good point. I think we'll touch on that later. Colleen?
Yeah, hi. Thanks for having me. Colleen Sirhal, I'm the Chief Clinical Officer and Director of our Global Consulting for Hyland Software. Our healthcare practice serves about 3,000 healthcare entities around the world. Very thrilled to have Lisa and Chuck here with me, who are both customers of ours. We make a couple different products. In healthcare, really, our mission is to take unstructured content and bring that into our products for long-term storage and then connect those up with the technologies of choice, whether that be an EMR or whether that be a financial system.
Very good. Thank you, Colleen. All right, Chuck, let's start with you. How has COVID-19 impacted your organization and community?
Well, where do we start? We started seeing patients a little later than the West Coast and East Coast did, since we're in the Midwest. But we immediately had, stood up a command center in our emergency response to some of this. And we started looking at, what do we need to do? And so we actually moved about 5,000 of our employees to work remote. I actually had a team of my server and storage team actually did a pilot to make sure that the technologies that we had put in place would actually work, so we could actually do our jobs with that. So, we've had, quite a few challenges. Franciscan owns its own construction company. And so it's ton and blank. And so that we immediately started construction to stand up drive-through testing sites. We stood up respiratory clinics that were, in the Midwest, we call them pole barns. We didn't have the Amish build them though, but they went up very, very quickly so we could provide those services. The other things, like every other healthcare organization in the country, we immediately stopped doing all the elective procedures. And so we repurposed a lot of our employees that allowed us to ramp up in some areas and ramp down in other areas. And then we looked at our projects. We put some on mothballs. We slowed some down, and others we decided we weren't going to do at all, that we'd go back and revisit those because we knew priorities were going to change. And so we've really found a different way of engaging with our patient population. I've had the opportunity to work with some very engaged physicians and other members of the clinical staff on new ways of taking care of our patient population, both in the ambulatory setting and in the acute care setting. And so our service techs that do field service learn how to go into isolation areas, which was a really new thing for them because they never had to do that before. And so we quickly did that. So I think that we're the same as every other organization that I've spoken to as far as how it's impacted. We just recently had, we're in Marion County, Indiana, where my corporate office is. Our corporate office is in Mishawaka, which is right next to South Bend, but the IT department in one of our data centers is here in Marion County, and the mayor has just extended the stay-at-home order until June 1st. That means I can't get a haircut, not that I need one, but until then. And so, and I also, my manicure is for my wife as well. So she's really waiting for those to open back up. So it's been interesting, but I have to say that our teams, all of our IT department is working remotely, and we hadn't missed a beat. And I'm quite very proud of them.
Excellent. Lots there we'll follow up on. Lisa, how has it impacted your organization?
Yeah, we are being in very close proximity to New York, particularly our Greenwich Hospital, which is just adjacent to the New York border, was hit very hard and very early. We, started seeing cases in late February. That hospital in particular, at one point was almost full its entirety of COVID positive patients. I think we saw incredible collaboration as a state, hospitals collaborating with other hospitals who are normally competitors, honestly, really bonding together to care for the communities that we serve. The virus then spread across our state to the east, really along the shoreline border where all of our health system hospitals are. And so about every 2 weeks, we would see a peak at the next hospital as the wave sort of rolled through. We peaked overall in about mid-April. We had at that point nearly 800 COVID positive patients across all of our hospitals. And we had been moving very quickly. We were adding beds, unshelling units that had been empty. We were building inpatient units in what used to be operating room, PACUs. We shifted our entire cancer population out of the cancer hospital to our campus across town to make way for the top 3 floors of that building actually were built to be negative pressure rooms. They were engineered. We built that building shortly after 9/11. And so our minds were thinking about managing for all types of emergencies. And so, you know, picture moving hundreds of sick cancer patients. We moved them across town and all the services that support them, and turned the top 3 floors of that hospital into negative pressure units to handle the COVID population. Throughout that, you know, all of the work of our IT teams, you know, we're fortunate. We've got extensive use of an electronic medical record, but building all of those units and the bed designations and connecting it all to the downstream systems, our IT team split themselves into 2 shifts, 1 working days, 1 working nights, so that we were essentially working around the clock to keep pace with the shifts in the bed stacks across all of our hospitals. We stood up 300 additional ICU level rooms. So took what were non-ICU beds, turned them into ICU rooms. Our clinical engineering team also reports up through me. So we were, you know, working hard to be sure we had enough ventilators, repurposing anesthesia machines to turn them into ventilator devices. We partnered with local high schools who wanted to leverage their 3D printers, and we were printing the splitting devices that allow you to share a ventilator between patients. We worked with local manufacturers to create new ways to monitor remotely the ventilators in a COVID positive room, and actually can change the ventilator settings from outside the room today. So it's really, you know, I think overall what has struck us as an organization is just the creativity, the focus on a single mission to help people in a crisis, and the teamwork that just has come out incredibly strongly. I'm happy to say we've now leveled off. We are on the decline. The governor is intending to reopen the state on the 20th of this month. So we are now turning our attention to that recovery. How do we ensure the communities that our environments are safe for them to come back into to receive what's now been months of deferred care? And so we also have that strong concern that people with, you know, cardiac and neurologic conditions, there's a reticence to come back into the healthcare setting, and we're working hard and leveraging technology again to make it as contactless as possible as people re-enter our care settings.
Very good, Lisa. Thank you. Colleen, what sort of have you heard, experienced from your clients about what they're going through, and then just sort of a vendor perspective? I mean, how's this been in supporting your customers?
So, I mean, Lisa and Chuck gave a very eloquent answers to their perspective. Very much what we're hearing from, you know, our customers, it varies based on the hotspots across the country. You know, areas like the, you know, greater New York area where Lisa is, it's been like a war zone. And talking to customers of ours that are on the front lines, watching folks that serve on our advisory councils go back from their administrative roles to direct patient care, has been something that we're seeing. But even in areas where there are not hot spots, this is really creating an innovation time. So once we get through the war zone piece, there's some really interesting opportunity, and those that are not in the hot zones are looking and learning, and then thinking about how they could apply some of those lessons learned in their areas. And this isn't just U.S. based. So we have customers all over the world, in Canada, Singapore. So through the, you know, Singaporean healthcare system, the vast majority of those customers are using our technologies and have been watching and asking us as a vendor, what are you seeing? How are your customers in New York? How are your customers in Florida? How are your customers, you know, in California working through some of these issues? So that's been really fascinating. The number one conversation that we have with customers is around collaboration. So tools and how can we help enable with the tools that we provide better collaboration. And so that's been really interesting, just reimagining what this kind of new normal is going to look like.
Very good. Thank you for that. All right. Next question. Lisa, in addition to anything you had mentioned in your previous answer, thoughts on other ways that sort of IT really stepped up and delivered solutions here?
Yeah, I think some of the most unexpectedly impactful things were simple. It was deploying iPads to patient rooms so that these patients who are very isolated, one of the big changes for the hospitals was to eliminate visitors, right? So we have patients now, they're afraid, they're alone, they're in an environment where everything's out of their control, and simply providing them with a tool that enabled them to connect with family and loved ones or some of the most heartfelt stories. I have cards and letters from patients and families, and we saw lots of patients pass away throughout this, and to be with their loved one in the final days and moments of their lives, even virtually, was something that was just incredibly appreciated. Those technologies that even for our caregivers, right, our nurses and doctors, they're exhausted. They're in personal protective equipment. Once they're inside a room, donning and doffing the equipment and leaving the rooms was just another stressor. And so we stood up, telehealth and telecommunication capabilities from every COVID positive room so that the staff in the room at the sound of their voice could get their question answered, or someone to bring a supply to the room so that was very much facilitating the hard work that they were all doing. We scaled our ambulatory telehealth remarkably. So just since that early March timeframe, we've done 120,000, telehealth visits. That's, probably up hundreds of fold from our pre-COVID baseline. And so allowing care to continue in a time when people couldn't come in to their doctor's office has been really important. We stood up call centers. We've increased our patient portal adoption, again, 2- and 3-fold to keep patients connected to their care teams. And as Chuck mentioned, sent about 8,000 to 10,000 employees to work remotely so that we could keep our workforce safe. All of that has just been, I think, amazing. And, we often joke, we've been saying these are all the right things to do for a number of years, and we've managed in a matter of weeks to do what would otherwise have taken us years to accomplish.
Very good. Chuck?
Yeah, I mean, I'll echo a lot of the stuff that Lisa said. The thing about it is I was talking to Charles yesterday, and I told him, I'd rather be lucky than good looking, and I got my wish. Because a lot of the technologies that we were putting in didn't realize that they were going to be we were going to stress them like we did. We had one, what I call a secure access solution, and we were putting in another one that was, we were a Palo Alto shop, and so we were looking at and playing with, trying to trial their Global Protect VPN solution. We had planned to put that in over a course of 6 months. We did it in a week. We moved 5,000 employees out to work at home remotely within a week and a half. And, particularly our billing office, we have 2 central billing offices, one for ambulatory, one for our acute care. And there are call centers attached to them, and we moved them out all remotely with soft phones. And I was really amazed at how we started leveraging some of the technology that we had been strategically planning to implement and was working on, but we had to ramp it up and get it done. And so it was really interesting how quickly, and the support of the vendors was really great because we needed some technical support from Palo and a few other ones. The other thing that we were ramping up to do was rolling out. We converted to Office 365 last year. And I'm a big advocate for that platform from a collaboration standpoint. I love Teams. And we went from 0 to 10,000 miles an hour with that from a collaboration standpoint. We rolled it out to do a lot of the virtual visits that Lisa mentioned, to do physician to other caregiver communications for visitor to at home and to the patients, with several other virtual technologies too. And I'll share one of the interesting things is that I found that you put those technologies and you collaborate, and the physicians realize that they have a willing partner to go figure stuff out. We had a cardiology group that just basically took a hold of it, and they had one physician doing rounds with all of our COVID positive patients in one of the facilities, and they had a group of physicians, the other collaborating physicians, internal pulmonologist, pharmacist, nursing, sitting in a conference room with a team session pulled up on the big screen in the conference room, and they were doing what I call communal rounding on these patients. And every patient they rounded on, their care plans got changed based upon that collaboration of care. And we started discharging patients using the same kind of process. And so rather than nursing having to go run around and find all the specialists that were taking care of the patients, they were all in one room together, or other parts of the organization that could participate in that collaborative approach to providing care. And we discharged patients hours earlier so we could turn those beds. It's really interesting about how we apply the technology. I've been doing informatics for a long time. It's really, it goes back to somebody says, don't let a good crisis go to waste. Well, guess what? The crisis required innovation and collaboration and support from a lot of folks, and we got that. And so it's really good to see everybody step up and do all the things they need to do in order to take care of our patients. We're a faith-based organization. Our sisters, the order of the sisters that own this organization, there are at least 2 sisters in the chapel 24 hours a day praying, and we needed it.
Yep, very good. Colleen?
It's interesting, and Chuck said something about 7 weeks ago on a call with some of our customers. We gathered up a group of our advisory council members, and Chuck said something that really resonated. We've been using this internally as a mantra. And he said, what used to take 6 months, now we got to do in 6 days.
Yep.
And that's something that has been a banner we've been holding up inside Hyland. So I want to thank Chuck for saying that, because it really resonated from our CEO and chief development officers all the way down. And people have been thinking about how to engage differently with our customers based on that. And so thinking about how do you get virtual? How do you help support all these remote teams? How do you approach getting projects done faster and how do you advise customers in a way that is not intrusive but is helping them meet their internal goals? And something that we've really focused on from the work we're doing with customers, we have seen almost no slowdown in our projects or implementations. And where we have been faster is connecting with customers on how to better leverage the current tools that they have in their tool belt. So we have a piece of technology that is used in the enterprise imaging space. It's a clinical viewer, and there's a piece of that functionality called collaboration. And we found that customers weren't necessarily turning that on. And the reason was it's hard to get, in our old world, hard to get doctors to turn on pieces of technology, and who do they really want to collaborate with I'll tell you, we have a customer in New York City who turned that on without ever even sharing it, that they were turning that on, and they had over 3,000 hits on that collaboration tool. And what it allowed people to do is that they were in a room on a device and they needed to look and share radiology images, X-rays, right?
Yeah.
And they could hit that and they could share it with a colleague outside the room or down the street. Or if they had something going on and they needed to consult with, a physician and expert in another organization, back to what Lisa was saying, the collaboration happening in areas that used to have a lot more, the competition was fierce. That collaboration is happening. And this little piece of functionality and turning it on and just the value seen out of it was astonishing to us. And so now we're getting on the phone and we're doing these one-on-one sessions with customers that are on that tool. And we're saying, okay, this is what we're seeing driving value. Here's how you could turn it on. Here are the best practices. And that piece has been, I think, a great benefit of this. And from a vendor point of view, a lot of that has been driven by the CIOs partnering with us and having these conversations and saying, okay, here's the 3 things we're thinking about. Can you make this happen for us? And we've been an organization that's been able to say, yeah, let's do it. So it's been good. That open communication has been fantastic.
Very good.
Well, one other thing, Anthony, I want to add. One of the things that we in this IT shop, we have a slogan that everything we do is clinically focused, operationally led, and technology enabled. And so that's the approach that we've taken with just about everything we do.
Very good. All right, excellent. All right, next question. Chuck, I want to go with you on this one. Talk about moving staff, and you touched on this a little bit. Is there anything else you want to add about the difficulties of enabling remote staff? There's the speed element to it, but so you could talk about that. But beyond that, and is it done, or is this something that's ongoing? Is everybody coming back, or do we have to see how things go? If everybody's not coming back, are there things that you did to get things up and running, sort of quickly and temporarily, that need to be sort of put in concrete now and for the longer haul?
Well, I mean, I think that we're definitely going to see a new normal, and we're already having those conversations. Not only new normal, how we get work done, but also how we care for our patients. And I think some of it will go back to the way it was. There's some work processes that just need to be on-prem, but there are others. There are a lot of the IT functions that are being done quite effectively and with more productivity than if they were in the office. I get another couple hours a day because of no commute to do work, which is a good thing, bad thing too. But the other thing, my commute's like 20 feet now rather than half an hour. But the speed in which we had to go kind of shone the light upon some of our configurations and stuff that just didn't lend itself. But the other thing we had to remember is when we move people home, we no longer have control of the entire the digital transaction that takes place between the workers and the computers. As far as being able to manage the bandwidth, we're at the mercy of ISPs. The other thing that we had done is since we're a hospital, we can take advantage of the AT&T FirstNet program where, I'm not sure if you're familiar with that, but after 9/11, the federal government contracted with AT&T to stand up a separate network for first responders. That when everything else doesn't work, this network works. It's got a different bandwidth. It has different priorities. And so they added healthcare to that. And so we had just ordered hotspots to use in the event of a crisis or a disaster. And so we had those on hand, and in some of the places that staff either couldn't get internet access to their homes or their ISPs were just crappy, we were able to give them a hotspot, and they were very easily able to work. So there's some configurations on our laptops. How you lock them down and manage them inside your organization is much different than what you have to do. The thing we did is, you can imagine, nobody has 5,000 extra laptops laying around gathering dust. So we got very creative about how we moved equipment home. When people work in their office and they're used to having dual monitors like I do, and you ask them to go home and work on a laptop, that doesn't work very well. So we had to get very creative about how we do that. And so once we find out what the new normal is going to be, we're having conversation with some of the business leaders around what do you think? Do you think all your staff is going to come back in the office? Well, no, because a couple of reasons. We need to continue to social distance. And, we can rotate staff in and out, but is that going to be the most appropriate place? Or can we go ahead and just allow a majority of that workforce to continue to work at home? And so I think that in talking to some of my friends and other healthcare organizations, they believe about half of their workforce is going to remain working remote. And some of the folks I've talked to on my leadership team, their staff has already asked if they can continue to work from home. And so I think that will be the new normal.
Very good. Lisa?
Yeah, very similar. We had a lot of the right building blocks in place in terms of a virtual private network and virtual desktops that really enabled people to quickly and seamlessly, I think to everyone's surprise, just move their work to the home environment. We also don't want to invite everyone back into the workplace. We actually have a deliberate part of our recovery strategy and beyond is to maximize teleworking as a part of the way that we now operate. So my colleague, the Chief Human Resources Officer, and I are co-leading that effort to continue. We've surveyed thousands of employees who've been working home to understand any challenges that they have had, but what they see as the opportunities and benefits, so that as we relook at our policies and procedures around remote working, we can take all of that into account. People are incredibly positive about the opportunity to continue to work at least some of the time from home. And so then we're also being very thoughtful about how do we ensure people still get that sense of community and team. And so connecting again through, collaboration tools like this, but thinking smartly about with social distancing, the right way to have social and other meeting opportunities as well. And then, we're a teaching institution. And so, thinking about that portion of our mission and how we continue to use technologies there as well has been a really important part of this. But we've told people if you are currently working from home, you will continue to do that until you are expressly invited back in, but that this is now part of that new normal. But we had to get creative. You're right, Chuck, we didn't have 5,000 laptops sitting around, but we sourced equipment pretty quickly. In some cases, we, dismantled desktops and equipment that were sitting on now empty office buildings and allowed people to pack them up and bring them home. To make it more permanent, now we are dealing with those, is a dual monitor setup required, and how will we outfit that? But we think the benefits long-term far outweigh any of those short-term costs around making that happen.
Yeah, one of the things that we did, we stood up what we call a Help Desk 1.5 specifically for those remote workers because their needs are much different than what the Help Desk or our solution centers, as we call it, typically get. And so we staff that with technical people that could help plugging stuff in, troubleshooting routers and modems and other home connectivity stuff. And that was extremely helpful by not loading up our solution center with those kinds of calls, because those people are not qualified or trained on the tier ones to support those.
Yeah.
So Colleen, anything you want to add there?
Yeah, I mean, I think that the training and education part is going to be really critical. So as we go into this new remote workforce, making sure that our levels of management in our organizations have the training and skill sets to manage remote workforces. So we can put a lot of technology in front of them. I challenge our professional organizations to help us get better at those things. We, talking with customers, phenomenal partnerships between the IT side and the HR side, helping support policies and procedures and the efforts to take people home. From the outside looking in, the movement of staff to a remote, highly functioning team has been amazing. Across the U.S., watching from the large to the small, this dramatic change and how it's gone, for the most part, pretty well as a vendor looking at all these hospitals and interacting with them and seeing, really what works and doesn't work has been interesting. The other thing that I'm seeing is, we talked about move to the cloud and the work that was being done, and I will tell you that in the last 2 months, the requests to our team to help consult and help customers think through move to the cloud is up 400%. So I just think this is fueling healthcare, which is usually, a little behind other industries that have moved to the cloud and embraced that. This kind of a pandemic, a national crisis, has really expedited that move, and not just to, an EMR, but also all the adjacent technologies that support both clinical care and operational needs of a healthcare organization.
Very good. All right, next question. This is a fun one. Colleen, why don't we start with you? You want to relate a personally witnessed story which exemplifies perseverance, creativity, or leadership. I'm sure everybody working in the healthcare environment has something that has affected them deeply or impressed them that they will never forget. So your thoughts there, Colleen.
Yeah, so I have a customer that I'm going to mention by name, Henry Ford Health System in Detroit. They've been at the epicenter of the pandemic happening in Southeast Michigan, stood up their surge site. The enablement of that IT team to think broadly about how they continue to service the needs across all their hospitals, multiple regions across Michigan has been stunning to me. These are folks that have to move from urban settings to rural settings. And when I think about, they had a large number of their staff, not just clinically facing, but staff overall, that ended up coming down with COVID. They were early on in this fight. They had several clinical folks that unfortunately passed away from COVID. But watching that community come together and collaborate with us as a vendor it has really been inspiring. And so I just give huge kudos to that organization for what they've done.
Very good. Thank you, Colleen.
Mind me.
No, I don't think they would.
By name.
I don't think they would. Lisa?
Yeah, when I was first preparing for today and thinking about that, there are so many examples on the front line that I couldn't even begin to choose and share. But I wanted to highlight a portion of our IT team. We're often sort of behind the machine and under the radar, and the amount of work that needs to happen. I think we make it look seamless and easy, but wanted to highlight one portion of our team. As I mentioned, we were rapidly converting rooms to ICU level care. Not all of those rooms were capable of the remote monitoring to safely take care of patients. The personal protective equipment was in short supply. And so again, we were rapidly working to deploy the telehealth equipment, right? The cameras that were capable of tilting and zooming on all the equipment that was needed in these stand-up rooms, and thousands of these carts needed to be sourced. Our usual suppliers were not able to keep up with our demand. We could get some, but not all that we needed, and certainly not fast enough. And so I've got a group of really talented folks on our telehealth and clinical imaging teams. They're engineers and analysts, and they sourced pieces and parts of equipment. They set up shop. We have a regional operations center that's essentially a distribution warehouse for our health system. They took over, the entire first floor of that facility practically, and set up basically a PC factory. And they set to work with drills and wrenches, and I was quite worried. I didn't know what was going to come out of it. But as they would send me photos, it became our joke, that they were lining up the carts. It looked like the droid army, from Star Wars. And they met every need, stayed ahead of that curve as the pandemic spread across our state. And it was one of those things, the medical staff, our nurses, our administration is, you're not taking those away, right? We're going to get to keep and use those. And we saved thousands and thousands of pieces of PPE because staff were able to work in a new way. It's been amazing, but, there was never a task too big. People were just committed to doing what we needed to connect and protect our patients. It's just been phenomenal.
Very cool story. Chuck?
Well, I mean, it's, the way our IT organization is designed is we're housed separately away from all of our healthcare facilities. That's good and that's bad, because we don't get to see the online action and interaction with the patients every day. Mm-hmm. But one of the things, and I think this picture that was shared with me, and I asked permission to share it on LinkedIn and Twitter, was on Good Friday. As I mentioned, we're a faith-based organization. We had one of our facilities, all the nurses in the emergency room went out to the helipad, took a knee, and said a prayer before they began their shift. So to me, that one is going to stick with me for a long time, because it reminds me of why we're here. It's not how, what good, cool technology that I can put in people's hands, but taking care of that patient. And I'm married to a nurse. And so my job is to make sure that the technology does not get in the way and actually assist and takes work away so they can take care of that patient and have that human-to-human interaction that is required for people to heal.
That's a great story, Chuck. Very moving. Let's go to our poll real quick. I want to throw the poll out there and open that up. So we're going to launch that now. The worst of COVID-19 has passed. There may be a resurgence, but it will never be as difficult to manage as the first go-round. So just take a moment and answer that, and then we'll take a look at the results in a second. I want to get to one of my favorite parts here, the Ask a Co-Panelist feature. So, Colleen, I'd like you to go first. Do you have a question for either or both of your co-panelists?
I do, and this is something I am struggling with, so I seek advice. How do you combat Zoom fatigue?
Wow.
Oh, Lisa, go first. Go ahead.
As I said, wow, that's a really good question.
We're all spending our life on Zoom. It's like,
I think it's great. And I'll give her credit. I had a suggestion from one of the physicians that I work with, and she was on a Zoom call with me, and she said, Lisa, do we need to be on the Zoom? Are you going to share any content? Are there slides for the meeting? And I said, no. And she said, well, do you mind then if we both get up and walk? Can we just, do this on our phones and get outside? And I think that's just been an important, as as cool and interesting as it feels to be on Zoom, it gets old pretty quickly, right? But remembering that we don't always need to be, visually connected. And it was nice to think about. We were both walking outside and having a conversation is, I think, just one way to think about doing that differently.
Chuck?
Well, I mean, the thing about it is, for me, it's not just Zoom. I used to, my schedule's always booked from start to finish, but it's always those, what I call drive-bys, the interruptions and stuff that you get, when you're either you're trying to actually get some work done in your office. And I leave my door open all the time, unless I'm having a call that I need to either concentrate on or have a conversation that doesn't need to be overheard. But it's one day I found myself, I was on a Teams meeting. I was chatting at the same time within that meeting. Then somebody Skyped me at the same time. Then I got a text on my phone, and then I get then Charles calls me on my cell phone. So I actually have a speaker over here, a phone over here, listening to two conversations and trying to type at the same time. And I finally said, enough. I raised $4, and so I can listen to 5 conversations pretty well at the same time. But that truly is a little bit of overstimulation. So one of the things I do is I have some very early meetings with members of my leadership team, and so I get up in the morning, I'll put my earpods in, I walk our neighborhood, and so we'll have these what I call roaming meetings, and it's really interesting because as it's a little hilly in my neighborhood, so they get to hear me breathe hard as I go back uphill. But it's really interesting of what kind of personal conversations you can have during the time. So I agree. Get up and move, because it's my exercise is basically going downstairs to get a cup of coffee and walking back upstairs. And so I try to get out and move a lot. So.
Well, it's really interesting because before this, there's always been a lot of discussion about death by meeting, too many meetings, period, right? So that's always been an issue. That still exists. But now, as Lisa and everyone's pointed out, there is not just a meeting of itself. Now there's a video versus a non-video meeting, and a video meeting imposes a larger burden of attention, preparation, and focus, which isn't always necessary. No, this is very important. That wasn't nice, Chuck. No,
give you crap, son. What can I say?
Well, so to my point, it's yes. It's do we need a meeting at all? And then if we need a meeting, does it have to be video? Right? Do we not? We don't want to have video meetings unless they serve a purpose, right? Or
I think now that there's an expectation if you're going to have it.
Hold on, let's go, Lisa. Ladies first.
Go ahead, Lisa.
No, sorry, I was just going to say, I don't know, it sort of evolved, but we started scheduling just 30-minute meetings. Meetings by default have become 30 minutes instead of 60, which is also something I wish, we will continue as this goes forward. But
Yep. All right, very good. Let's
having a back-to-back schedule of 30-minute meetings all day long. So my wife asked me the other day, I went downstairs at 1 o'clock. She says, well, how many more calls do you have today? And I said, 5. And she said, oh, my God, I hope they're not hours. I said, no, they're only 30 minutes long. So you truly can have death by meeting.
You can.
Yep. All right, we're gonna look at the poll, but I'm gonna get everyone to guess on the results. So. Again, the question is, the worst of COVID-19 has passed. There may be a resurgence, but it will never be as difficult to manage as the first go-around. Chuck, what is your guess on the results there?
I don't think it's going to be as difficult as the first go-around.
I need numbers, buddy. How many people are going to agree with that statement? Give me a percentage.
I would think about 80%.
All right, 80% agree. All right, Colleen, what percentage agree?
I think it's less than that. I think it's probably 58%.
58%. I like the specificity. I like the specificity.
Yeah.
Lisa?
Yeah, I think it's the majority. Probably going to say 78%.
78? All right. Well, the answer is, and we'll share the 67%. 67% agree. So,
Colleen,
If this
who's
is
closer?
Price is Right. If this is Price is Right, I win,
Yeah.
right?
Price
Closest
is,
without
Price
going
is
over.
right.
Absolutely.
Well, you're both very, Chuck, we know one thing, Chuck lost. That's what we know, beyond doubt, right?
Well, as you had planned that way, that's why you called on me first.
Good. Very good.
I'm the pragmatic optimist. What can I say?
Uh-huh. So 67% think that the worst, well, at least if it comes back, it won't be as difficult. So that's somewhat promising. All right. One more quick question. Let me sneak it in. I'm being greedy. One more question, and one that I like very much. And let me go to Lisa first on this. What are some of the main things you learned about your team, your organization, or leadership? Actually, I would like to focus on leadership. So forget about your team and your organization. What is something that you learned about leadership through having gone through this experience? What's important? What matters?
Yeah, I think it was or is vulnerability and integrity. It was, this thing leveled the playing field. It was not important at all who had what title, who was leading what. Everyone needed to band together, and leading took that honesty, integrity, and vulnerability, I think.
Very good. Chuck?
Well, one thing that I found is that we have, Charles's leadership team is fairly new. I've been at the organization a little over a year. We've got two other leaders that have been there for much less than a year. One of them just came in March, at the end of February, 1st of March, right when we began this. And so, needless to say, he didn't even have a time to step on the treadmill. He had to parachute into it. So, the thing about it is that, I think, Lisa, you mentioned integrity is absolutely the case. The willingness to collaborate any hour of day and night, and to step up and to raise your hand, I got this, or I got this, or can you help me do this? And so there was no, measuring stick about, how we're going to help each other. We had a mission that we needed to get done, and it didn't make any difference who's rolling up their sleeves. And there are things I can do technically and volunteer to do. And my team looked at me and says, no, we don't want you to do that. And so I allowed them to do their thing. So the other thing I learned was sometimes a good process can be your enemy, because you can get yourself into a process thing. So there's one thing that people learned that I didn't like really quickly. When I asked for something, they said, well, Chuck, you need to open a ticket. And I said, wait. I said, you want me to open a ticket? No. I need to get it done. So after about the third time somebody said that to me, and there's another saying that nobody in this organization has ever said to me, because I warned them, don't ever tell me it's not your job, because it won't go well after that. So it is all of our jobs to meet the needs of this organization, regardless of what level we're at. So, having learned from those processes, we're kind of looking at those, or I am, as what worked well, what didn't work well. And I think we have to go back and do this self-reflection on that. And, some of the new leaders that came in formed some really quick bonds with other leaders in the organization, because we just had to in order to get stuff done.
Chuck, you're one of the nicest guys I've ever met, but I still wouldn't want to make you mad. So I will never tell you to open a ticket. All right?
Yeah. Well, no, the thing about it is people have never heard me raise my voice, because I don't do that. It's a way that my mother taught me how to look at people. And they understand, oh, by God, I've stepped off in it right now.
Boy. Oh, boy. I can feel it.
Let's just go get it done. Thank you very much for sharing.
Very good. All right, Colleen, I'm gonna give you the last word. Colleen, your thoughts on what you've learned about leadership, and any other thoughts you want to close us with.
So trust is key.
Trust, integrity.
Trusting your team, trusting your vendors, trusting It's just key. And communication. And I think the one thing that has been throughout this conversation we were having is how important communication is. It fuels ingenuity. It fuels great patient care. And, communication and really becoming an organization that values that and exemplifies that is a key to surviving any crisis.
Very good. All right. That's about all we had time for today. Regarding continuing education, you can use the final slide in this deck. You'll get an email when the recording of this event is ready for viewing. If you want to sponsor one of our upcoming events or book a custom event, you can reach out to Nancy Wilcox from our team. You can go to our site to register for our upcoming webinars. With that, I want to very much thank our panel. This was quite enjoyable and enlightening. Lisa Stump, Chuck Christian, and Colleen Sirhal. And I want to thank Hyland Healthcare for making this conversation possible. And with that, I, of course, want to thank our attendees. So with that, everybody have a wonderful day. Thank you.
Thank you.
Thank you.